Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.
DHT, skin, hair, and the prostate. When people talk about DHT, skin, hair, and the prostate always come up. But these outcomes are never driven by one variable. Hair loss, acne, and prostate changes are almost always multifactorial. Hormones play a role, but inflammation, lifestyle, diet, and supplements often drive the process long before hormones do. Inflammation is the common thread across most of these conditions. A shared underlying factor appears again and again. That factor is inflammation. Chronic inflammation from poor lifestyle choices, dietary strategies, supplements, or stress can disrupt hormonal signaling. Sometimes inflammation causes the hormone imbalance. Other times, hormone fluctuations sit on top of inflammation. Either way, it's rarely just DHT. Genetics decide the outcome. The biggest driver in all of this is genetic predisposition. You've seen it before. Some athletes run high androgen doses and never lose hair or develop acne. Others struggle quickly. This comes down to androgen receptor polymorphisms, enzyme expression differences, and tissue-specific sensitivity. If the genetics are there, these issues eventually surface. Accepting trade-offs. This is an uncomfortable truth. If you choose anabolic steroid use long-term, you may have to accept trade-offs. Perfect skin and hair are not guaranteed outcomes in this sport. If those are your top priorities, professional bodybuilding is likely not the ideal path. Why blocking DHT is often the wrong move. Here's the mistake many people make. They immediately try to block DHT, but DHT has important physiological roles. Blindly inhibiting it can create a suboptimal hormonal environment. Before reaching for inhibitors, the full picture must be addressed. Lifestyle, diet, supplements, and training stress. Human data on DHT and skin. Human research supports this nuance. In studies where men were exposed to very high DHT levels using DHT gel for up to 2 months, there was no increase in acne, no male pattern baldness, and no androgen-related skin pathology. Other studies showed no difference in sebum production when dutasteride was added to testosterone. DHT alone did not cause the problem. Prostate risk, estrogen matters more. Evidence also does not support the idea that androgens cause prostate cancer. What matters more is the androgen to estrogen ratio. Low androgens with higher estrogen may be more problematic, especially in genetically susceptible individuals. In many cases, androgens may actually be protective. DHT versus DHT-derived steroids. This is a critical distinction. DHT and DHT-derived steroids are not the same thing. Compounds like Masteron and Primobolan were designed to be less androgenic than testosterone. They are not DHT and cannot convert into stronger DHT metabolites. That's why they were originally used in females. Total androgen load is the real driver. At the end of the day, total androgen load matters most. If you're running extremely high doses and you're genetically predisposed, hair loss or acne will likely occur regardless of the compound. Different steroids vary in androgenicity, but dose and genetics dominate the outcome. Final takeaway. DHT contributes to skin, hair, and prostate outcomes, but it is not the sole cause. Inflammation, genetics, lifestyle, and total androgen load drive the majority of these effects. Blocking DHT without addressing the full system often creates more problems than it solves.
Victor Black.
Victor Black.
Uncle Victor.
Victor Black Masterclasses.
Mr. Victor Black.
Virtual Victor, the safer use model.